Welcome to Chapter 5. Today, we're exploring how culture, ethnicity, religion, family structure, and socioeconomic factors influence mental health and why nurses must understand these elements to provide holistic, effective care. As healthcare providers, we don't just treat symptoms, we treat people. And every person brings a unique cultural and social background that affects how they view illness, healing, and even us as their caregivers. Understanding culture is a shared way of life passed down from generation to generation. It includes beliefs about health, illness, suffering, death, and healing. It influences how a person expresses pain, who makes decisions in the family, whether they trust medicine or rely on traditional healers, and whether they expect a quiet, private care experience or a communal one with extended family. Example, a patient from a collectivist culture may expect family involvement in all medical decisions, while a Western patient may expect full privacy. As nurses, we must avoid assumptions. Not everyone from the same background follows the same cultural norms. We ask, we observe, we adapt. Culture is not defined by skin color or country. Two patients who share the same racial identity may have very different cultural beliefs. For example, a person from the Dominican Republic and one from Spain may both speak Spanish, but they may have different views on health, food, or family roles. Ethnicity and ethnocentrism. Ethnicity refers to a person's cultural identity shaped by language, customs, traditions, and often geography or ancestry. Ethnocentrism is the belief that one's own culture is superior to others. This can show up in gangs, extremist groups, or even in healthcare when a provider assumes one way of thinking or healing is better than another. As nurses, we need to replace judgment with curiosity and respect. Religion and spirituality. Religion is an organized system of beliefs in a higher power. It influences care decisions, expectations around prayer procedures, and even who can provide care. Example, a Muslim woman may prefer female caregivers. A Jehovah's Witness patient may decline blood transfusions. Our role is not to debate belief systems, but to honor them while maintaining safety and care standards. Chaplains and spiritual advisors are valuable partners in this process. Prejudice and bias. Prejudice means judging someone before you know the facts. Bias means leaning toward or against someone based on internal beliefs, often unconsciously. In healthcare, prejudice and bias can be dangerous. Example, a nurse may unconsciously assume that a poor patient is non-compliant when they actually have transportation issues or limited access to medication. We must examine our own biases and approach each patient as an individual. Non-traditional lifestyles and families. The concept of family has evolved. Families now include single parents, same-sex couples, blended families, and chosen families. After the 2013 Supreme Court ruling on same-sex marriage, legal definitions of family expanded. Nurses must ask open questions like, who is involved in your care decisions, instead of making assumptions? Homelessness and mental health. Homelessness is not a mental illness, but many people experiencing homelessness live with untreated mental health conditions. These patients face barriers to health care like lack of transportation, poor hygiene, food insecurity, and difficulty storing medication. Example, a patient with schizophrenia may miss appointments because they don't have a phone. This is not defiance, it's a systems issue. Nurses need to show empathy, not judgment, and coordinate with social workers and community resources. Socioeconomic status. A 1982 study by Aaron and Peterson showed that people with lower income levels experience more abnormal behavior. Why? Because poverty increases stress, limits access to care, and exposes people to trauma. We need to look at the full picture, not just the symptom. Holistic care includes attention to housing, income, and support systems. Parenting styles. Diana Baumrind identified 3 parenting styles. Authoritarian parenting is strict with low flexibility. It often leads to obedience but may damage self-esteem. Authoritative parenting is structured but supportive. It promotes independence and healthy development. Permissive parenting is lenient and lacks rules. It may lead to poor self-control or difficulty following structure. Understanding family dynamics helps nurses support child development, especially in pediatrics, and mental health. Abuse as a learned behavior abuse is the misuse of a person or power. It can be emotional, physical, sexual, or financial. Many abusers were themselves victims. Abuse is still abuse, even when the abuser feels in control or justified. Nurses are mandatory reporters. If you suspect abuse, you do not need proof. You are required to report it. Conclusion: culture, ethnicity, religion, socioeconomic status, and family dynamics all influence patients' mental health and their interaction with the healthcare system. Nurses must be culturally aware, non-judgmental, and compassionate. And we treat people, not conditions. And understanding someone's cultural and social background allows us to truly care for the whole person. Thank you for joining me.